Good afternoon, Aurora, and welcome to our 26th community conversation. Today is part 2 of the first conversation held on May 7th with the CEOs of our medical centers in Aurora. Now, 6 months later, I'm honored to have Rich Rohr of AMITA Health Mercy Medical Center and John Dietrich of Rush Copley Medical Center back with us. And this time, they've brought medical colleagues who will give us a deeper look into Aurora's healthcare scene. We also have our EMS battalion chief with us, Chief Tappendorf from the Aurora Fire Department, to give insight on the paramedic procedures. Additionally, we have Barb Jeffers and Michael Isaacson from the Kane County Health Department. All right, now before I ask everyone to introduce themselves and we get started, let me first thank our healthcare heroes of Aurora. What they have been through this year is unbelievable, yet they get up every day and give it their all to keep our community healthy as possible. Let's all out there in Facebook world, let's give you guys a round of applause. You know, this year for the 4th of July, we didn't have our traditional parade downtown. Instead, we held a processional in honor of our healthcare heroes, beginning at Rush Copley and ending at AMITA Mercy, with stops at half a dozen nursing homes along the way. It was the least we could do to say thank you. At that time, we were nearly 4 months into COVID and hopeful for our future. Today, we face a new reality with the resurgence of COVID-19 in our country, our state, and our counties and city right here in Aurora. Last Friday, 3 of our 4 counties were put on COVID mitigation by the state. We see the impact of the increased positivity rates that they are having on our community members and our economy. There's also a direct impact on our hospitals, and we'll talk about that today. We are joined today by medical professionals who will give us a closer look. And I'm going to ask them each to briefly introduce themselves and their titles, beginning with the battalion chief, then the doctors and nurses, and finally our CEOs of the hospital. Chief?
Thank you, Mr. Mayor. Good afternoon, everyone. My name is Chris Tappendorf. I am the Emergency Medical Systems Battalion Chief for the City of Aurora Fire Department. I've been a paramedic for almost 20 years, and I've been with the department for 21.
Thank you, sir. All right, let's go on to our nurses that we have on the line with us. Who are our nurses?
Mary Tinnen.
All right.
I am the director for the ED and the ICU at Mercy. I've been the director for the past 4 years, but I've been a nurse for 26 years, all of it at Mercy.
Wow, thank you. Thank you for your service. I see we have Aurora Martinet, Infections Prevention. Why don't you do it yourself?
Hi, my name is Laura Martinet. I'm a infection preventionist. I've been a nurse for 37 years. I've been in infection prevention for the past 20, and the last 10 have been at Mercy Medical Center.
Wow, that's great. Now let's go on to our doctors. Dr. Bob Manham.
Yeah, this is Bob Manham. I'm the infectious disease physician for Rush Copley and Mercy Hospital since 1994. So, 28 years? I'm losing count.
Welcome aboard. You look too young to be on anywhere for 28 years, brother. Then we have Dr. Mike Keller.
Hi, sorry you can't see me, but I'm Dr. Mike Keller. I'm the Chief Medical Officer here at Mercy in Aurora, and I'm relatively new. I started in mid-July, but I have had a long career in pediatrics as a pediatric critical care physician and physician executive. So really happy to be here and hear what everybody has to say.
Happy to have you, brother. And although we can't see you, your name looks good and you sound real good.
Thanks.
And before we go on to the CEOs and presidents, I'm sorry, we have Christy Walker on as well. You want to introduce yourself?
Hello, Mayor. My name's Christy Walker. I am the manager of regulatory affairs and infection prevention at Rush Copley, and I've been a nurse for about 27 years.
Wow. Thank you for joining us. And then we have our 2 health department officials here. We'll start with Barb Jeffers.
Can you hear me?
You can.
Okay. I'm Barb Jeffers, and I am the Executive Director of Kane County Health Department. I've been at Kane County Health Department for the past 15 and a half years. And of those 15 years, I have been the Executive Director for a little over 8.5. And now Michael, I'll introduce Michael.
Go ahead, Mike.
Good afternoon, everyone. My name is Michael Isaacson. I am the Assistant Director of Community Health here at the Health Department. I have been on staff at the Health Department for 20 years. Happy to be here.
Wow. All right, then let's go on to our president and CEOs of each hospital. Let's start with AMITA. Rich?
Yes, good afternoon. My name is Richard Aurora. I'm the president and CEO of AMITA Hospital Mercy Center here in Aurora. I've been in healthcare for over 25 years, 17 years within AMITA, and just over 13 months here at Mercy Hospital. And Mayor, thank you for having us on again. It's a pleasure to be here. Absolutely.
Look forward to the conversation, brother. And last but definitely not least, let's go to Rush Copley. John?
Good afternoon, Mayor. My name is John Dietrich. I'm the president and CEO of Rush Copley Medical Center. And I think most of you know on this call that I grew up in Aurora, on the east side of Aurora, attended Marvin Academy. I've been with Rush Copley my entire career, dating back to my high school days working in the kitchen at Copley. And I came up through the ranks. I've been here 28 years professionally, and also was the COO here at Copley and became president about 12 months ago, 1 year ago, pretty much today. So it's been an interesting year, and I look forward to sharing my thoughts with you today.
Thank you, kind sir. All right, well, you know what, ladies and gentlemen, let's jump right in this. You know, we got folks that are really concerned about, you know, what's going to happen with COVID over the next couple of months. We've heard it termed as probably some of the darkest days we'll see in our country as it concerns this pandemic, and the fact that it's right associated with our flu season. It's right during our flu season, so it's going to get much worse. And I think most people, even if they get sick with the flu, the presumption is going to be COVID. You know, so let me start. You know, I'll start with you, John. You know, what experiences so far have you had with COVID, and where are we going to go in the future, brother?
Yeah, well, Amir, it's really, I can't believe our first Facebook talk was May 7th. It seems like years ago. But we, you know, Copley has really been through a lot, as has Mercy and the rest of the providers in our local area. You know, we have definitely seen a resurgence in cases since Labor Day, and we thought this is really timely to have this talk. You know, back on May 16th, we had 61 inpatients in our hospital. That was a peak. And then thankfully, through July and August, those numbers came down to single digits daily, and we did a great job of managing the process and the disease. Those numbers have started to creep back up into the teens in September, soon after Labor Day, and now into the 20s in early October here. And now at this moment, we're at 24 inpatients in-house today, so we definitely have seen an increase. Luckily, only 2 of those are in ICU, and no patients, knock on wood, are on ventilators. And we'll have the experts talk about that and why that's an important piece. But over time, since March 17th, when we had our first confirmed case, we've treated and cared for over 2,000 COVID patients here at Copley, over 500 inpatients. Our current bed usage is at about 78%, which means that we have enough beds to care for all inpatients, COVID and non-COVID. And we can also manage a moderate COVID resurgence. But we want to get the message out to the community to stay vigilant so that our healthcare system and resources don't get stressed like we did last spring. We learned a lot from the process in the spring. Operationally, we learned many lessons. Our personal protective equipment is in strong supply now. Our caregivers, our first responders did a great job of caring for our patients and really protecting our employees and our medical staff during some really, really emotional times. So we've learned a lot over the last 8 months about this virus, and you'll hear more from our panel of experts today. But we just want to get the word out again that, you know, it's normal to feel COVID fatigue. No one wants to wear masks. No one really likes the social distancing or changing their normal daily and social activities. But really, it's more important now than ever to contain this thing. So we want to get that message out today.
Absolutely. And Rich, what's been Mercy's COVID experience so far, brother?
Well, Mayor, first of all, let me say thank you very much to the people in our community for those who supported us through the first wave of the pandemic. I can't express enough how fortunate we are as a hospital, the support and the outpouring of giving that our community has given us, and particularly the leadership within the city and the health department, our restaurateurs, and just our patrons of the city here. The donations, the food donations, the drive-bys, the signs on the front lawn. I can't express enough thank you for that. Our team here is very, very heartfelt in all the giving that's been done. So I just wanted to start with that. You know, as it relates to COVID and the second wave here, as we're going to call it, I would tell you that, like John, we're seeing the same amount of numbers. We're in the 20s this week. The difference we're seeing this time, however, is unlike the first wave, and I think John would agree, Chicago really went first, and then our surrounding communities kind of picked up, and we were sort of last. And right now, Aurora is sort of leading the way, even in front of the Chicago, particularly the lakefront of Chicago, where the numbers are spiking pretty quickly. So that's a little bit of cause for concern. And again, I couldn't say strongly enough, for us to remain successful, we need to keep the masks on. We need to keep the hand washing done. We need to really be conservative about gathering in large groups. And I would tell you that one of the best things that we've learned from the first part, and I would tell you the first part, we all learned this together, is really what to expect from our communities, and not just in Aurora, but across the state and the country, is, you know, where people are congregating in large numbers and how that's going to affect the hospital systems. So I think we've learned a lot in the first go around. And again, the city leadership, health department, and police and fire have all been fantastic in partnership through this process. You know, as it relates to now this sort of second wave, you know, it's a little bit different in the fact that I think what we're seeing is a little less acuity. I don't see as many people coming into our ICUs. I don't see as many people on ventilators. But that's not to say we need to let our guard down, because we shouldn't. You know, we're seeing more children get sick as we're trial and erroring, going back to school, you know, part or full time. We're seeing people in the 20s and 30s getting sick, so it's not just the elderly. So it's more of a broad range this time. But the good news is we've learned from our previous event. And I think we're much better prepared to take on this one, and hopefully it's not going to last as long.
Absolutely, absolutely. You know, you bring up some good points. You know, cleanliness. You know, wear the mask, wash your hands, use hand sanitizer. Simple things that we can do to protect ourselves, and most importantly, our family, our loved ones, each other. So let's talk about readiness and infection prevention in healthcare. First question. Cleanliness established through ATP testing on surfaces to ensure that surfaces are disinfected. You know, what is that? Explain that and the importance of that. And we'll start with the infection prevention individual. Laura, you want to go ahead and start with that? Markinette, we can't hear you. You might be on mute. Tell you what, we can't hear you. Well, we'll come right back to you. So just make some noise at some point. Let me see if we can hear you. But for some reason, we lost your sound. But I had heard you earlier. But we'll go to RN, MSN, RN. Oh, there's a lot of letters here. Regulatory Affairs and Infection Prevention with Christy Walker. Explain what all that means and
Okay, well, at the hospital, we want to ensure that once we clean something, that the surfaces were cleaned thoroughly. So there's testing that can be done in order to show us that we're doing a good job at cleaning. So we can do ATP testing, we can do bioluminescence testing, and we can also do other things that we know we have, like UV light cleaning, to ensure that the surfaces in the hospital are clean. I know once we started into this pandemic, we really amped up and enforced our cleaning at the hospital. So waiting areas, restrooms, patient care areas, everything, more cleaning is being done, and more testing to ensure that those areas are clean is being done. And we've been doing an excellent job. Our goal is to keep everybody safe. We know that you can have contact with COVID. So we want to keep the areas safe. So through these avenues of heightened cleaning, using UV light, and then testing to ensure our areas are clean, we can assure that when people come in, they're coming into a clean environment.
First of all, what does ATP stand for? Do you know?
You put me on the spot here. ATP is
What does it mean?
It's a testing. It's like bio testing that you put. It's a swab test that you do on surfaces. You put it in a machine to determine what the load of burden is on there. Is the area clean or not?
Gotcha. Now let me ask you, and we'll come back to Laura in a second as soon as we get her sound back. But all right, so this is in the hospital. What can an individual do at home to ensure that their surfaces are clean? For their kids, for them, for their whole families.
It's frequent cleaning. So approved disinfectants. Online they have approved disinfectants. I know everybody probably has been to the store and you can't find a box of Clorox wipes. But there's other disinfectants that are approved. So I recommend making sure you have disinfectants, cleaning air surfaces after every time that you're using them. Be vigilant. Also surfaces, doorknobs, toilets, handles, anything that we're touching frequently, outside doorknobs, those sort of things. Just make sure that you're cleaning and you're vigilant about it to reduce the amount of contact surface area infection.
Thank you. Now, doctors, we have Dr. Rial and Dr. Manum, and then Dr. Keller there. So, gentlemen, and I'll start with Dr. Bob Manum first. Reporting COVID cases to public health is important, and it's important for individuals to have access to healthcare as well. Can you talk a little bit about the importance of reporting cases? Because I expect there's folks that probably get sick out there and are scared to come to the hospital and don't want to report it. So can you talk about that a little bit, Doctor?
Thank you, Mayor. Thank you for having all of us. The importance of testing and reporting and being involved with this reporting is important. So we know where the disease is, how active it is. We can also give good information to the patients and their families to stay home, to avoid visitors, especially during the time that they are ill. They don't want to transmit this to a loved one. So really being involved with getting yourself tested and then following the advice once you are tested is very important in the control of this disease, not only for your family, your immediate family and relative, but also for the community in general, and in the same light for the economy. We want this virus to be shut down.
What about Dr. Kelleher? What would you tell the individuals out there about the importance of getting tested?
Well, thank you, Mayor Irwin. I would take the hospital perspective here and say it's really important for us to be able to get information from our public health agencies, from the Illinois Department of Public Health, and from all of the county departments of public health that's reliable, so that we can know how bad it is out there and we can prepare better in the hospital, make sure we have enough beds and nursing staff and ventilators available. So I think from my perspective as a chief medical officer, that's the primary importance of having really reliable data. In addition to all of the other things that Dr. Manum mentioned, which I also agree with. But from the hospital's perspective, we need to be prepared if we're going to be able to adequately serve the community, and that it's the data that prepares us. Absolutely.
And, let me flash back to both our president CEOs, both Rich and John, for a second. Gentlemen, we're talking about the importance of being tested, the importance as soon as someone gets sick to get tested, especially, when we're pushing up on flu season. Somebody doesn't have, the health insurance or doesn't have the access to any type of medical care. What do you suggest to those folks? Recognizing it's still important for them to be tested because they could be spreading this disease.
I'll start. I would tell you this, aside from the hospitals, there are many different venues in which people can get tested. So we certainly don't want to hold people's tests back because of lack of insurance or under insurance. they can still come to the hospital. There are test sites all around the region. The health department puts up test sites. The county puts up test sites. So there's certainly no shortage of test sites, and I would still strongly encourage people to go out and get tested if they suspect they have COVID. The other interesting piece, and this is why this presentation is so timely today, is that we're in the onset of flu season. So people may be at home, experience symptoms of flu, and may automatically think they have COVID. And we certainly don't want people to stress and cause more anxiety in an already high anxiety situation. So strongly encourage you to find a place to get tested. If they need help in places to get tested, they can call either one of our hospitals. They can call the county health department. We'll provide access and locations for all those test sites.
Okay. And John, let me take it to the next level. Let's say someone is tested and they don't have, access to health care or health insurance. What's the next step? How do they get the care?
Well, Richard, we strive for health equity throughout our community at both hospitals throughout the county. And, we make sure that we have access to testing, as Rich said. We have access through the Kane County Health Department, through IDPH, through different test centers, through the VNA. If you are symptomatic and you need care, you can come to Copley Community Care. You can go to our either emergency rooms in town, and we will take you and care for you regardless of your ability to pay. And that's really a commitment we all have to our community. And we will set you up with the proper primary care as a result of those treatments to make sure that you maintain and manage your health going forward as well. So that's really important to all of us in this community to make sure we have health equity across the board.
I see Rich nodding his head, in agreement with that as well. Is that correct?
Yes, absolutely. AMITA Health and Mercy Hospital here in Aurora, we are a mission-driven organization. We also are a not-for-profit organization. We take people that come in our door regardless of their ability to pay. So it's certainly part of our mission. It'll always be part of our mission. We pride ourselves on that. So anybody who needs healthcare should come on in and seek healthcare accordingly.
Absolutely. And Laura, do we have your voice back on yet? Can you hear us?
Can you hear me?
We sure can. You sound great. So I just want to go back to you a
Great.
little bit because you're infection preventionist. What does that mean, and how does that help with COVID?
Well, infection prevention used to be called infection control, but there are some things that we want to look at from a prevention standpoint. And my biggest message for the Aurora community is prevention. From what we're seeing that's preventing to our emergency room and to our inpatient settings are people that are out there in the community that may live in multi-generational families, and they may participate in activities that they feel are safe for them, but then they may have the impact of what it brings into the home front and what they're bringing back from exposures that are in social situations or that are in work situations. So what we really want to emphasize is that people think about the activities that they're doing and the impact on the members of their family and their extended family, and some activities that they may have done previously without masks that they would consider now to wear the mask, so that when they're presenting into the emergency department or that they need to be hospitalized, there's information that we need to ask the public to share with us about their employment, about those activities, so we can help with contact tracing and share that information with our health colleagues.
Absolutely. You know what? That actually takes us to the health department. So Barb, can you explain how the health department fits in with these hospitals, and what is contact tracing, and are we doing it?
Yes, first and foremost, Mayor, thank you for the opportunity to speak to the Aurora community and those who have joined today. This is a great way to get the message out and get some valuable information for the community. So contact tracing and how does that help? So one of the things that's really important for us to do as a community and public health is to know where the infection is so that we can contain it and control it and respond to it. And the way we do that is with contact tracing. And so what does that mean? That means if you test positive, someone will call you and find out where have you been in the last period of time? There's a period of time that we would begin to look at, where have you been? And what we do is once we take that information, we start calling others who may have been in contact with you. And that's called, what we try to do is do an epidemiological link. What that means is if you and I were in the same place at the same time, that's probably where you were exposed. So it's important to know first where your exposure occurred. When you know where your exposure occurred, you can actually look at who may have been impacted from your exposure. And so when we know that, then that's where we do the containment. We say all of these people need to either quarantine or isolate themselves. So that's the most critical point. When we do that, we catch you early so you don't continue to spread, because some people like to think, well, I don't have any symptoms, so I don't need to, be out. But that's the even worse, because the science is showing those who are asymptomatic might be spreading the virus quicker and longer than the symptomatic individuals. So it's really important that we begin to pull everybody together and say, stay home, isolate, quarantine, because if you don't, the greater the spread, we've heard it, that's where we become a burden on our healthcare system. If everybody continues to be out spreading, and I know some of us like to think, well, I feel great, but it's who you're spreading the disease to that may not feel so great and require hospitalization, require ventilation, and the end result could not be well for some. So contact tracing is critical. So when you get that information, it's important. I know many of us feel that that's an invasion of my privacy. Well, no, it's not. It's so that we contain the spread of this virus, that we limit it, that this is a community has always pulled together to support each other. You've heard everybody on the hospitals and everybody talks about how great we are. Well, this is another way to be a champion in your community, to share when you know you've tested positive, share with us so that we can track down those individuals to minimize the spread and contain it so that our rates go back down. We don't put a stress on our healthcare system, and we get out of this sooner than later. I can't hear you, Mayor. You must be on mute.
Yeah, right. Michael, I know. I said exactly, Barb. Preach. Mr. Isaacson, Michael, do you have anything to add to that, brother?
Well, I just want to emphasize what Barb said and look at the seriousness of this. So even if somebody feels well, if they've been contacted and told that they should be on isolation, it's really important that they stay home, that they're not going to the store, that they're not going to work. And unfortunately, we hear too many things where people know they're positive and they're still going out in the community. Likewise, if you've been exposed to someone who has COVID and you've been interviewed by a health department team and you've been told to quarantine for 2 weeks, it's really critical that people stay home for those 2 weeks, because that's how we stop the spread of this disease. And as many people have mentioned, just because somebody feels fine, that doesn't mean that you're not still spreading the virus. And I know everybody has COVID fatigue, and we understand that people don't like to be told what to do. So we want to give people the information so they can make informed choices. And they may feel fine, but somebody that they pass this disease on could become seriously ill. So we just encourage everybody to really think about the seriousness and take appropriate action.
And, I'm going to jump in and agree with you there, Mike. No one wants some health department official calling you, telling you got to stay in the house for 2 weeks. It's hard. But when both you and Barb called me when I contracted COVID-19 early on in the middle of March, you said you can't go out. You've got to stay in for 2 weeks. You got to stay away from people. And I did exactly that, because not just to protect my family, protect my friends, protect the community from what might occur if this disease continues to spread. And you guys explained to me that staying away from folks kind of chokes this disease out and kills it, because it doesn't give that opportunity to pass from one person to another. But let's kind of shift a little bit and ask our battalion chief here. What kind of information does a person need when they call 911? What would I be asking of you to say? I might have COVID. I'm not sure if I've got it, but maybe I'm coughing a little bit. Maybe I've got allergies. probably no big deal. What kind of information would I need, and what would you say to somebody calling, that might have contracted COVID?
Well, first off, if you have any problem, any medical emergency, please call 911. We're always here to help. Calling 911 is a beginning step to reduce that stress that's put on you when you do have a medical problem. The 911 dispatcher, they will have several questions. First and foremost will be, where are you and what is the problem? As soon as that information is found out, they'll start sending the fire department. Then the dispatcher will also have some additional questions. The general questions are, how old is the patient? Has the patient ever had any other medical problems, et cetera, et cetera? Those are all just to help us paint a picture and understand what kind of emergency we're going to. Right now, during COVID-19 times, dispatcher is also going to ask several questions that relate to this pandemic. Has anyone in the house had COVID-19? Have you been diagnosed with COVID-19? Has anyone there got any of the symptoms? As far as I know you're sitting there talking, thinking, well, all those symptoms are flu-like or cold-like. They are, but as far as 911 and the Aurora Fire Department are concerned, we're treating every patient that has those symptoms as if they may be positive. That doesn't mean they are positive, but they may be positive. So we're going to show up and do our thing as if you were positive until it's proven otherwise.
And let me ask you, has there been a huge change over the last 6 months from March, when this first kicked off real strong, to now, in the folks you pick up and how people communicate with you about how they feel?
It's been, there has been quite a few changes. First, since February, the beginning of COVID-19, we've, when we arrive on scene, we've changed to, we always have a mask on now. Matter of fact, we're always wearing a mask, even here at the station when we're out training. Just like has been said earlier today, one of the things that we can do to try and slow down the spread of this virus. When we get to your house, we would like for you to come outside. We want you to come outside. It's safer for you. It's safer for us. If you can't come out, that's okay. We will go in. But one of the things that we're doing differently in that aspect is we're only sending in maybe as little as one person, one paramedic, to get a better understanding of what's going on. If that paramedic decides that he or she needs some assistance, he or she will call out to the paramedics that are standing outside, ready to go, and then we'll immediately come in and help. The other things that we're doing differently come to what we're wearing, our personal protective equipment. When you have a certain 4 or 5 different procedures, we have to change our gear, and we have to start wearing an N95 mask and wearing a gown along with goggles to protect us and you. It's not necessarily because you have COVID or we have COVID. It's because these procedures that we're doing require us to wear this gear. So those are the big things that we're doing. And as far as cleanliness, we've always been cleaning our ambulances and et cetera to the similar standards as the hospital. So we really haven't changed cleanliness that much. We spray it down with disinfectant. We wipe all surfaces, sanitizing with a sanitizer that is known to kill both bacteria and viruses. So, and as far as personal stuff, we wash our hands. We're following the same things that the CDC is doing. We're washing our hands regularly, using sanitizing gel, wearing a mask out in public when we're training here at the station. All the things that you would try and do just to try and slow it down.
Absolutely. Thank you. Let's switch over to, and that's a very good point. Call 911. We got the fire department or ambulance that'll actually transport you to the hospital to determine, for the hospital to do the test to determine if you have COVID. Mary Tennant, Director of Critical Care Services. What is a COVID screening test like, and what's the turnaround times these days?
So the COVID test is, I guess I would describe it as a large Q-tip that would go up your nose. And it is uncomfortable, but I wouldn't say painful, necessary so that we can get the right amount of virus on there. There are a couple different tests. There's a rapid test that we do, which we'll get back within 30 minutes to about an hour and a half. And then there's also a PCR test, which is a longer test, and that one takes between 2 and 3 days to get back. During flu season, it's possible that you could actually have a third if we're suspect that you have flu, not COVID. So there is a chance you could actually have 3 of these nasal swabs in one visit to the ED.
So wait a minute. Okay, so 3 nasal swabs, one for an instant test, which isn't as accurate. Is that why you would have the second?
Yes, the first test is not quite as accurate. Dr. Manum could probably say the percentages, or the infection controls could say the percentages, but it is very accurate. It's just not quite as accurate as the PCR test.
So if you
So
get
we
one of
will
those
do that
instant
after.
tests, you
Mhm.
automatically get the test that takes 2 to 3 days to come back as well.
Not automatically. We do those for certain people. So if you are going to be from the emergency department, you have to go and have we're thinking you're going to have a procedure or a surgery, then we would do that. Also, if you are we think you're going to be admitted to a behavioral health facility, then we would automatically go and do the long test as well, the PCR test as well. So, or we suspect that you definitely have COVID, and the first test, we want to follow up with that test.
Now, the Battalion Chief Tappendorf just said that his officers as firemen and women, when they when they go to someone's house and pick up a patient, they're wearing PPE, personal protective equipment. Now,
Correct.
what do the healthcare workers wear at the hospitals?
So they will all have on a mask, and then either goggles or a face shield all the time when they are in the rooms and the hallways. That's what they wear. If they suspect that you have COVID or you are going to be getting a COVID test, then they'll add an N95, the gowns, the gloves, and then you'll have the full, what we call tier 3 PPE protection for that.
Thank you. Let's turn to our physicians doctors on the call. We've heard both Rich and John say that it seems like COVID-19 has changed from the time when we first encountered it, in March, where there were more people on ventilators and more people in the hospital for a longer period of time, sometimes even in a coma. How is this resurgence, this second wave, different, Dr. Manum? How is the second wave different than when it started in the spring? You're on mute.
That's a great question. So the number of people becoming ill is certainly high. The number of people needing hospitalization is a little bit lower. And the people that are in the hospital, they are also not, for the most part, as sick. But when we break it down to the at-home elderly, 65, 70, 80, they may take a very serious sick illness, and it can be very sad outcome. So if younger people are getting it who have no significant comorbid problems, they're seeming to, for the most part, do reasonably well. But those people who do need to come to the hospital, they use a lot of resources. Simply coming to the hospital, they're looking at a stay in the hospital anywhere from 3 to 10 or more days. That's a long time. And it's a lot of work. It's a lot of oxygen. It's not, we're not necessarily intubating these patients, but they're requiring a lot of care. And those who are a little bit older, these are the people at home, everybody's mother and father, grandparents, those kind of patients who are at home, they can become very ill. So I'm not going to say it's not as bad. For some, it is just as bad.
Gotcha. Dr. Keller, you had pointed out earlier that, when it first started, that I don't know if the focus or the warnings were to our seniors, to the elderly, those folks that are most vulnerable, our older population. And I think you had pointed out that now we have, children getting COVID-19. We have teenagers and young adults getting COVID-19. So why are they less sick than, say, someone else? And are they less sick? Are people less sick this time around from COVID than when it started in March?
Well, I think if I could answer those, I might win the Nobel Prize. But it's clearly the data from the AMITA hospitals show that the population hospitalized this time is skewed towards younger age groups. So, and younger patients do seem to get less sick with this. It may have to do with how the virus attaches to cells and enters them, and the receptor's not there in the younger children, so they don't get quite as sick. I don't know, Dr. Manham probably knows more about that than I do, but it really is the case right now that the population being hospitalized is on the younger side. Of course, the fear is that as the infection spreads in that cohort, that eventually grandma and grandpa and great uncle get exposed and get it. And then we would see more what we saw in the first wave with a more elderly population. And as Dr. Manham points out, a higher disease severity and worse outcomes, more use of ventilators, higher death rate, things like that.
Now, Dr. Manham, I'm going to switch back to you just for a second, and say, when we hear, that we got younger people, as Dr. Keller pointed out, getting sick, but they're not getting sick, as sick as folks were in March, people tend to let their guard down, and say, all right, well, this almost sounds like a cold or the flu because I'm not getting as sick as, what I hear on television. And I'm not people aren't on respirators anymore. They're not having in large numbers. They're not having long hospital stays in large numbers. And as you pointed out, it could somebody that could be there 3 to 10 days and be really sick, but that's not happening, everybody. What would you tell the community about making sure they keep their guard up? And even though they're not real sick, or they're not very symptomatic, that this is still serious?
Yeah, that's a great question. How do we get everybody on the same page? I think we're all in this together. This virus, the activity of the virus must come down for everybody's betterment. Yes, if you are in a low risk population, that's great for you. And you should still hand wash. You should still try to maintain your distance. You should still wear the mask because you don't want to catch this and unknowingly give it to another person in the community, your parents, your uncles, whoever. And I think everybody is on the same page. And the whole thing in general, if we could bring the activity of the virus down, we can get out of this sooner.
Let's go to our nurse, one of our nurses, Christy Walker. Let me ask you a question. When somebody walks through the door, and they end up and they are tested and contracted COVID, what are some of the symptoms that they feel? And I understand that their symptoms are different for different people, but generally, what are some of the symptoms that people feel? You're on mute.
All right, can you hear me now?
Yes, ma'am.
All right, so for people coming in, the symptoms vary, like you said. A lot of people are coming in febrile, so they have a fever, cough, shortness of breath. A lot of patients that we've been getting recently are having congestion, loss of taste and smell. They're having nausea, GI symptoms, diarrhea. So they vary drastically. So with the upcoming flu season, it's going to be a challenge to determine is it flu-like symptoms with the achy joints and the malaise and the fatigue, or is it COVID symptoms with those same things? So we have to be very vigilant and protect everybody. So if you're having any of those symptoms, just make sure you're protected. So use your mask, use your hand hygiene, social distance in order to protect everybody.
Thank you. And let's go back to Dr. Keller one more time, sir. There's been such an emphasis on people getting their flu shots. Make sure you get your flu shot. There's a vaccine that is available for the flu, and hopefully one soon for COVID-19. Why is that, and how can people tell the difference between COVID-19 and the flu?
Well, I think Christy hit the nail on the head. It's really hard to tell the difference. A lot of the symptoms overlap. I think that, for example, in both you have fatigue, muscle aches, just not feeling very perky. I think the thing that's unique about COVID is the respiratory difficulty, the shortness of breath, and the need for supplemental oxygen occur pretty rapidly and are generally much more pronounced than you see with influenza. So I think it's going to be hard to tell, though. Every flu season, the CDC and the local health departments follow what they call influenza-like illness. And if you look at the description for influenza-like illness, there's a great degree of overlap with COVID. So it really is hard to tell the difference. And that's why testing is going to be very important. The ability to test as Mary pointed out before, that, it sounds like cruelty to have 3 swabs, but it's really important to know if you have COVID or if you have influenza, because there are treatments for both, but they differ.
And let me jump back to the health department, Barb Jeffers, for a minute. Now, Barb, talking about that, where you are alerting the general community of Kane County about the importance of getting vaccines for the flu or get the flu shot. What are some of the things that you're hearing or experiencing dealing with the health department?
So one of the things, as everybody has indicated, since the symptoms mimic each other, but the outcomes are very different, it's really important. We know we have something in our toolkit to combat the flu. It's a flu shot. So the first and foremost, to minimize having a combination, because it's not unheard of to have the flu plus COVID. You can potentially have both. So you're on mute, Mayor. I can't hear you.
Let's say that one more time. That's important. You can have the flu and COVID at the same time.
Those are 2 different viruses. So it's really important that every single person of age get a flu shot, and we reduce your risk of getting the flu. And then if you are symptomatic, as those who have indicated, you go get the right test for either the COVID-19 or some other ILI. So it's important that we all know what we can do. This is to prevent, we do this together so that we prevent you from, again, getting so ill that you're hospitalized. And I can't say it enough. We have a vaccine for the flu. We're waiting on a vaccine for COVID. And until that happens, we use the tools we have: masking, washing your hands, and keeping a social distance. But I can't, those of you who have said all along, I don't need a flu shot, I never get the flu. Well, this is the year everybody should get a flu shot. We have the flu vaccine, and just for your safety, for the safety of your families and your loved ones and your friends and those you don't like, I say get a flu shot. And because that's what we have available to us, and it minimizes your risk. And if you just get COVID, then you go and you get tested. But please, 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 I appeal to everybody on this call to get a flu shot, because that is so significant to keep your health and wellness during this COVID season.
All right. We've got about 10 minutes left. I want to take a few questions from our listening audience. So, Mr. Muhammad, do we have any folks that have questions for our guests?
Yes, sir, Mayor. Thanks to everyone again. People are just really commenting how great this information is. A question is regarding antibody testing. What's the purpose? Is it available? How do people find out about it? Just some general thoughts on antibody testing.
Dr. Manham?
So antibody testing is available. For a normal person, normal patient, it probably is not very helpful, but it can give the physician or the healthcare team an idea that this patient has already had COVID in the past. How much in the past? Well, in the last few weeks to months. It may not tell you much more than that, but it is kind of an important thing, because there are many people that have had COVID and they're coming in and they have a positive antibody. Their illness that's presenting today may not be acute COVID. It could be recent COVID, and they may have some other type of respiratory illness. But again, the use of the antibody for in general is not much use for the general public. It's more academic at this point, or maybe more public health related.
So let me tell you, let me see what correct me if I'm wrong, let me tell you what I just heard. That for the general public, even though a person like me may have had COVID-19, it's still important for me to wear a mask. It's still important for me to wash my hands and assume that I could potentially get it again. Is that correct?
That is absolutely correct. For the information that we have now, we do not know exactly how someone will be quote unquote immune to COVID. There could be people that have had a very mild asymptomatic case of COVID, not really register with a good antibody response, and could get COVID again. There are other people that have had COVID 3 months, 6 months ago. They may not be immune at this point. So it is not a passport to not wear a mask. Wear the mask, do the social distancing, and we just need more information.
Absolutely. Wash your hands. Mr. Muhammad, another question.
Sir, are there different strains of COVID? This person's heard that there's maybe some developments over the last 6 months. There have been different strains that you can catch more than one.
Dr. Kelleher, and then after that, Laura McInnet. Go ahead, doctor.
Well, I think I'll defer to people who have more expertise on that one, Mayor Irwin. But many viruses have exist as strains, and as COVID replicates in a person, it produces millions, billions of new viruses, and that process is imperfect. And so as that process proceeds, there are mutations in the virus that then get propagated out into the population. So the answer is yes. But I think Dr. Manham or Laura Markinet might be able to give more information than I.
Let's go to Laura first, then we'll come to Dr. Manham. Go ahead, Laura.
I think that definitely our earliest wave of COVID, and we're also seeing the presentations that patients are
Lost you just a little bit. We lost contact with Laura. We'll come back to you in a second. It's very choppy. Dr. Manham.
Okay, so I think the question was, are there different strains?
Yes.
There are, as a virus passes through the community, naturally over time, there will be minor mutations, but the overall footprint of the virus is the same in this situation. The minor mutations may in fact be somewhat responsible for COVID of today being different than the COVID that was in New York City in April. So it may not be as ferocious and virulent, but there are other aspects, and this could change. It may turn back to being ferocious and virulent. Mm-hmm. So there are some known and expected minor mutations, but the overall COVID virus is about the same. A body will recognize it at about the same at this time.
Gotcha. Mr. Muhammad, another question?
Yes, sir. We say there's going to be a dark winter. The question is to the heads of the hospitals. Are you concerned about hospital capacity, if that's the case? And are elective procedures still happening during the resurgence?
Rich?
Yes, to both questions. So we have plenty of capacity at both of our hospitals. I think John would concur. Mm-hmm. And I would tell you that, yes, elective procedures are still happening. And I also want to stress that something we've learned from the first go around with COVID is that, and we helped with that message. You stay home for us and we'll be here for you, for those who really need to come to the hospital. And what we've learned now is that we really want to see people come to the hospital if they're expressing any type of symptoms for anything, whether it's flu or whatnot, because what we don't want you to do is stay home and get more sick. And then by the time we see you, we're treating multiple things, or it's in some cases it's drastic. So Yes, so lots of capacity at the moment. We'll see how the COVID numbers continue to increase. Hopefully that won't last too long. And then, please seek healthcare when you need it. Don't wait.
John?
I'd say the same thing as Rich. We have capacity. We're here for our community. We'll continue to be here. Surgeries are still happening. We have not shut down any procedures. GI procedures are happening. Ambulatory visits are happening. We have capacity for imaging procedures. So please, please, please go. If you're having any symptoms, if you have a need for healthcare, do it now and get it taken care of, and don't let it get worse, because that's going to put stress on the system later on when maybe there is a COVID resurgence that is a little bit more stressing to the system. But for right now, we look good. We just need the community's help to keep us at a capacity level that we can manage this situation very well, as we have been.
Mr. Muhammad?
Final question here. Commenter said it's great to see Aurora coming together as always, but we do know that there may be individuals who are not coming together. Question for the health department: what type of enforcement procedures are out there for those who are not following the governor's orders?
Michael?
So our first step is always to work together with the business community. So I want to repeat something Dr. Manham said. We're all in this together. So our community, our healthcare system, EMS, we're all only as healthy as the best behavior that we have. So when individuals or businesses are not practicing safe behaviors, they're really putting the rest of our community at risk. So if we receive a complaint, we will follow up with that business. We'll talk to them about their individual situation, make a determination if we need to escalate at all. And then we do have authority to issue fines. Again, it's our preference not to do that. But if somebody is really blatantly disobeying the rules and creating a dangerous situation, we will work with the state's attorney's office and local municipalities to enforce the rules that are in place.
Thank you, sir. I want to thank all of you for joining me this afternoon to talk about our fight against COVID-19. And as you pointed out, as many of you pointed out, we're all in this together. As someone who contracted COVID early on, I want to pretend like, it's not real. I, like so many other people, I'm tired of wearing masks. I'm tired of walking out of the house. It happened to me this morning. I'm walking out the front door and I remember, oh my gosh, I got to go back and get my mask or walk up these stairs, we're tired. There's COVID fatigue. But recognize that we can get past this by doing these simple things as wearing masks, as social distancing, as washing hands. And although we're tired now, if we continue to work together as a whole community to fight this, we can beat it. But if we don't work together, and I'll give you a chance in a second, John, I'll let John and Rich close us out. If we don't continue to work together and do what's necessary, this thing is going to last for a while. Now, we're hoping that we get a vaccine soon, but even once we get a vaccine, it may take a while for our general population throughout the United States to actually get it, and form some immunity to it. So until that happens, we're not out of the clear, and we've got to do what's necessary to protect ourselves. And if it's simple as wearing a mask, if it's simple as washing our hands, if it's simple as social distancing, then we owe it to our community, to ourselves, to our families, to our friends, to everybody we know, to the general population, to make this happen. John?
When you said we're in this together, it just kind of struck me. One thing I know is this: the COVID pandemic, for all its bad things, has really brought us together as a healthcare community like never before. Copley and Mercy collectively have been caring for the city for over 200 years collectively, when you add up the number of years we've been serving the community. And we both have the support and expertise of two large healthcare systems. At Copley, we've got the Rush University Health System, at Mercy, the AMITA system, which brings a lot of resources and expertise and reputation to help fight this in the Aurora community. I really think the community needs to understand that. We also have the support and expertise of the Kane County Health Department, so I really appreciate our partnership with Barb and Mike. And, really, as Rich said earlier, we've had hundreds of local physicians, nurses, respiratory therapists, other caregivers, first responders, everyone working together towards a common goal. And it just kind of strikes me in a time of, divisiveness in our nation. I'm really proud that the Aurora healthcare community stands united to manage this pandemic. So it's really a blessing to know all of you on this call, and just want to say thank you for your partnership.
Rich?
Absolutely. I can't say thank you enough. And I would also say that know that in the city of Aurora and the surrounding communities, we're very, very fortunate to have 2 hospitals in our city here to serve this community. And I would tell you that regardless of what anybody says, we are right now the safest place to be for medical care. So we're here, we're waiting for you, we're here to serve you, and we're going to do that in a safe and reliable manner and get you back home as quickly as we can. This is our business, this is what we know how to do, and I'll tell you, we've learned together as a community. If you haven't gotten that yet, just look at the faces on the screen before you. We are partnered here in this community, strong partnership that's going to continue to serve this community, united as one, and we're here to serve. So please don't hesitate for your care. Come in and see us if you need to.
I want to thank you all for joining this afternoon, to all of our experts, our nurses, our doctors, our first responders, and to our health department. Thank you very much. This is real, and we're not out of the woods by any means. And if we just continue to work together as we have, as the partnerships with all of us throughout Aurora, we'll beat this thing together. Thank you all very much for joining me. We're signing out. Thank you, friends. Bye now.
Thank you.
Thank you, Mayor Owen.